Hi, this is Dr. Praveen here. Today we are going to learn the anatomy of upper GI endoscope. So we have three parts here. So this is the main part. So and this is the one which is get connected with the machine. So this part is called as umbilical cord, which get connected to the mother instrument. This is umbilical cord, and this one is the controlling unit, and the rest of the part is the insertion unit. So this is the insertion unit, controlling unit, and the umbilical cord. So I'll keep the umbilical cord away and keeping the controlling unit and the insertion unit with me. Look here. So this is the method of holding the instrument. With your left hand, you in the first interphalangeal dock the instrument. Okay, and here we can see two wheels. Here we can see two wheels. One wheel is bigger and second wheel is smaller. Two wheel and two buttons here. Two buttons with a different color code. For the first one is red and second one is blue. So these are detachable, and you can't put the blue on the other area. So the blue ring, blue nozzle. So this is for suctioning. So when you hold like this, your index finger should operate the first button, superior button, and the middle finger should operate the inferior button. The superior button is for the suctioning, superior suctioning, and inferior button is for the inflation or instillation. This is for the to push the air and to push the water. So when you press like this, it does the suctioning, and when you block like this, it start inflating the air. When you press like this, it start instilling the water. Hope you understood. So the first button need to be pressed for suctioning, and second button just to block this nozzle. Just block this nozzle, start instilling the air, so to inflate the stomach, inflate the esophagus. So this is for inflation, and when you press like this, this is for the instillation of the water. It pours the water in the jet manner. So we have learned the two wheels, bigger wheel and smaller wheel, and two buttons. What is the function of these wheels? So these wheels has to be operated by using the thumb and sometimes even middle finger also. Even the thumb is more than sufficient. So you can see here, the bigger wheel is to move up and down. The big wheel is for up and to look up and down. The small wheel is to look right and left, right and left. So here there is an indication right, left. This is down, up, down, up, right, left. So most of the time we require only the movement of the larger wheel or big wheel. No, usually very less oftenly we require the small wheel. And the button what we have here is just as a handbrake of the vehicle. Okay, this is in unlocked condition. So if you do like this, it become locked. If you are doing any procedures like banding and all or sclerotherapy, when you wanted to keep the scope, the tip of the scope in the certain position like this, if you wanted to keep like this, when I relieve, start re-attain its normal position. So if you wanted to keep in the retroflex position and all, so you can just lock this and it will retain unless you unlock it. So soon I unlock it, it returns into its normal position. And there are some different buttons, like here the different company has different buttons just to freeze the images and all. Okay, and we have another port here. This is the biopsy port. It varies in the size, like 2.8 mm to 3.2 mm. So this is used even sometimes in the syringing, and when you wanted to instill a larger amount of water and all, then also we can use this, or else the biopsy probe, to pass the biopsy probe also we can use this port to take the biopsy from the operating site. So this is about the controlling unit of the endoscope. Next, coming to the insertion unit. So you can see the markings here. So the first marking starts with 20 centimeter from the incisor, and all we can measure the how much exactly at what point our tip it is. So that is the main purpose of putting the in this one, numbering here 20, 25. For 25 there is no any number is given. 30, 35, 40. Usually we get when it is at the incisor, for the 40 centimeter at the incisor. So usually the tip will be at the OG junction, and in short peoples, females and all, usually at the 35 centimeter, and afterwards 50. So till 110 we get the measurement here. 110 for upper GI endoscope, and 160 centimeter. So this is 1 meter. So in the most of the cases we get the till 110. So 160 for the colonoscopy. 160, the length of the insertion end will be 160 centimeter for colonoscopy and 110 centimeter for the upper GI endoscopy. And the thickness, coming to thickness, the thickness of the insertion, that is the diameter of the insertion tube, varies from 6 mm to 11 mm. So based on the, if you are using the scope for the to insert through the nasal and all pediatric age group, then we go for 6 mm, or else the normally used thickness is 9 mm. And for procedure purpose, if you are using the upper GI endoscope and all, then you can go for the big, so comparatively higher diameter scopes. So this one has the diameter of 0.9 centimeter, that is 9 mm. The diameter of the scope is 9 mm. So what is the diameter of esophagus? So approximately 2 centimeter. No? So it goes inside without touching any wall of the esophagus. Once we cross the larynx, when we enter the esophagus, so usually it enters the esophagus untouching. So this is the insertion. Let us look into the parts of the esophagus, tip of the esophagus, scope here. See, as I told, for diagnosis, this is end viewing lens. So sometimes for the ERCP and all, we get the side viewing cameras. So this is the end viewing camera. So as I told, we get the size of the scope varies from 6 mm to the 11 mm. In 11 mm this one scopes and all, we are getting 2 operating openings. Here we have only 1 operating opening. This is for the this is said as a biopsy forceps. And whenever if you wanted to push a larger amount of water and all, so from here you can push it off and it comes through this opening. So this opening is a biopsy opening. Okay, and we have 2 light source here, one on either side. So that is LED lights, and this is the objective camera, and a small opening here. This is for the installation of water and insufflation of the air, this one. So it will wash the camera. So whatever the air water jet comes, so this will be poured on the camera. So if any material comes over or in obstacles or air bubble comes, so we can instill or do the suctioning and all. So this is about the tip. And coming to the umbilical cord, so we have two openings on the either side. This has to be attached with the suction instrument, and this is for the air and water jet. This is for the air and water jet. This is for the suctioning. So this is the anatomy of this upper GI endoscope. So this end has to be attached with the mother machine, and here we have to attach the suction tip, here the water and air jet, and afterwards it's ready to use. Once the machine is get on, so this is ready to use, and this is how we have to hold it with our left hand. Okay, so this is the method of holding the instrument, and with this, so hold it at 20 centimeter, and you can first, when you inserting, a slight bending is required. So this is about the anatomy of the instrument. If you have any doubt regarding the anatomy and parts of the instrument, please write in the comment box, and if you like this video, then kindly subscribe to the channel. So hope you have enjoyed the video. Thank you.